Welcome to the deep dive. Today, we're looking into something, well, kind of invisible, but a massive threat.
Hmm.
We're talking about gastrointestinal parasites in animals like llamas and alpacas.
Camelids, yeah.
And also in deer, elk, moose, the cervids. It's this silent, insidious world inside them.
It really is. And it
Crazy.
affects so much agriculture, wild ecosystems, even, human health potentially.
So our goal today really is to cut through the complexity.
Right. We want to give you the essential knowledge, maybe some surprising facts, and just a clearer picture of why these tiny things cause such big issues.
Because the core problem, as I understand it, is that we've leaned really heavily on chemical dewormers for decades.
We have
Mhm.
anthelmintics, yeah. And now we're facing a global crisis, multi-drug resistance in key parasites.
It's like an evolutionary arms race.
And we're not winning at the moment, frankly. Many traditional control programs just aren't effective anymore.
So what's the answer then?
Well, it's prompted this big shift towards something called integrated parasite management, or IPM. It's a much more holistic approach. Think science-backed, combining smart drug use with things like pasture management, nutrition, biosecurity.
Host factors.
Yeah, focusing on the host animal itself, even breeding for resistance. It's multifaceted.
And this ties into that broader concept, One Health.
Absolutely crucial. This isn't just about fixing one sick llama. It's about recognizing these deep connections between domestic animals, wildlife, their shared environment.
Because they increasingly overlapped, farmed animals and wild ones.
Precisely.
Yeah.
Farmed camelids, ranch deer, wild deer, domestic sheep, and cattle.
Yeah.
The lines are blurring.
Yeah.
And that creates this complex web for parasites to move around.
With consequences that ripple outwards.
Across whole ecosystems, yeah.
So let's dig into that. Why should, the average person care about these microscopic invaders? How do they really impact things?
Oh, okay. Start with farmed animals, llamas, alpacas, ranch deer. GI parasitism is like a primary cause of sickness, death, and real economic loss.
Real money.
Huge money. We're talking young animals, crias, fawns, not growing well, diminished fiber quality in the camelids, less milk, problems breeding, and even death.
Wow.
For South American camelids, internal parasites or endoparasitosis, it's consistently ranked as one of the most economically damaging disease categories, period.
So a massive drain on farming, but what about in the wild? You hear that parasites are like natural?
That's a good point, and yeah, they are. Parasites are a natural part of wild ecosystems. They absolutely influence animal behavior, body condition, reproductive success, survival.
Like population control.
They can act as a regulatory force, especially when host populations get really dense, but they definitely cause significant disease too.
Any examples?
Sure. There's fading elk syndrome. It's caused by Ostratagia species, leads to this progressive wasting away, and it causes substantial illness and death in wild elk. And then there's the meningeal worm, Paralophostrongus tenuis. We'll probably talk more about that one. It's carried by white-tailed deer, but it severely limits where moose and elk can successfully live and expand their range.
So that brings us right back to that One Health idea. In this cross-transmission, a decision on one farm could hit wildlife.
Without a doubt, and vice versa. The overlap is increasing. Farmed animals, domestic livestock, wildlife, they're sharing space, sharing resources, and inevitably sharing parasites.
Like specific examples.
Yeah, research has actually confirmed, for instance, that wild roe deer and domestic sheep grazing the same pasture share the same GI nematode species. Easy transmission.
And then they're the ones that can jump to humans, zoonotic ones.
That's another layer of complexity. Parasites like Echinococcus granulosus, that's the hydated tapeworm, and Cryptosporidium parvum. Their life cycles can involve wild dogs, coyotes, wild deer, domestic dogs, livestock, and us.
Yeah. Making it a public health issue, too.
Absolutely. Controlling them isn't just about animal health, it's public health.
So the big takeaway here is we can't think in silos anymore. Farm health, wildlife health, environmental health.
Exactly. It's all connected. Any modern approach has to be integrated. Farm decisions affect wildlife. Wildlife affects farms. We need that ecological framework.
Okay, let's shift gears a bit. Talk about the animals themselves. Camelids versus cervids. They're different biologically, right? And that affects the parasites.
Big time. It really starts with their digestion.
Right.
Cervids, your deer, elk, moose, they're true ruminants. Classic four-compartment stomach.
Right.
Rumen, reticulum, omasum, abomasum. Like cattle or sheep.
Okay, familiar territory, but camelids are different. Pseudo-ruminants.
That's the term, yeah. Or foregut fermenters. They have a unique three-compartment stomach, usually called C1, C2, and C3. C3 is functionally similar to the abomasum in ruminants.
And it's more efficient somehow.
Very efficient. Slower passage of food, really good at extracting nutrients and water, key adaptations for the drier places they evolved in.
So how does that difference, the stomach setup and passage time, impact parasites or how we treat them?
Well, it can definitely alter the dynamics between the host and the parasite. And importantly, it affects how drugs behave pharmacokinetics. Absorption, metabolism,
Yeah.
it can all be different.
Uh-huh.
Plus, something practical. Camelid skin and that really dense fiber coat. It makes pour-on dewormers, the ones you just put on the back line, largely ineffective.
Really? They just don't get absorbed.
Not reliably, no.
Hmm.
So for llamas and alpacas, we're generally stuck with oral drenches or injectables.
That leads to another really key idea. You mentioned host-parasite relationships, especially this concept of an aberrant host. What's that about?
It's super important for understanding disease outcomes. So first you have the definitive host. That's where the parasite becomes an adult, reproduces.
Yeah.
For the meningeal worm, P. tenuis, that's the white-tailed deer.
Okay.
Then you might have an intermediate host, needed for larval development, but the parasite doesn't mature there, like snails and slugs for P. tenuis.
Got it. So what makes an aberrant host different?
The aberrant host, sometimes called an accidental host, is one that gets infected but isn't part of the parasite's normal life cycle.
So the parasite makes a mistake.
Kind of, yeah. In that aberrant host, the parasite often gets lost, literally.
Mm.
It might migrate abnormally, it usually fails to develop properly, and here's the kicker. It often causes much more severe disease than in its natural definitive host.
Ah.
P. tenuis in llamas, alpacas, moose, elk. That's the classic example. It gets into the nervous system and causes devastating neurological disease, which it doesn't typically do in deer.
Wow. So it's not just the parasite, it's the match between the parasite and the host. It's evolutionary history with that host.
Exactly. A parasite that's relatively benign in its usual host can be highly pathogenic, even deadly, in an unsuitable aberrant one.
That's a huge aha moment.
It explains a lot about cross-species transmission issues.
Yeah.
And it feeds directly into the parasite-host environment triad. Disease isn't just one thing. It's this dynamic interplay.
Right. The three legs of the stool. Let's break that down quickly. The parasite itself.
Factors like the specific species, its virulence or aggressiveness, its reproductive potential. Remember Haemonchus contortus, the barber pole worm. One female laying maybe 10,000 eggs a day.
Incredible.
And its life cycle strategy, direct or indirect, needing intermediate hosts. All matter.
Then the host factors.
Age is huge. Young animals are nearly always more susceptible. Immune status, nutritional health, especially protein levels, and even genetics play a role. Some animals are just naturally more resistant.
And stress.
Yes, like the paraparturient rise. Stress around birth and lactation makes females temporarily more vulnerable, shedding more eggs.
And finally, the environment. That must be critical for parasites spending time outside the animal.
Absolutely crucial. Temperature and moisture are the big drivers for eggs and larvae on pasture. Warm and humid, perfect for Haemonchus. Wet, oggy areas, essential for liver fluke snails.
And how we manage the environment matters too.
Definitely. Management practices can create high-risk situations. Overstocking pastures forces animals to graze low, ingesting more larvae. High stocking density means more manure, more contamination. Irrigation can create ideal conditions for certain parasites.
Okay, now we get the dynamics. Let's talk specifics, the major parasites we need to worry about. Starting with nematodes, the roundworms. You said these are the pervasive ones.
They are most common, most diverse group. Cause everything from just poor doing to sudden death. And they're the main reason we use dewormers, which means they're the main drivers of resistance.
Let's hit the HOT complex first. Haemonchus, Ostratagia, Trichostrongylus, they often get grouped together.
They do. They're all trichostronchales. Similar direct life cycle. Eggs in poo, larvae hatch and develop on the ground, crawl up grass, get eaten. Simple but effective.
So Haemonchus contortus barber pole worm sounds dramatic.
It is dramatic. Arguably the single most pathogenic and economically important GI nematode for small ruminants and camelids worldwide.
Why so bad?
It's a bloodsucker. Lives in the abomasum or C3. Literally feeds on blood. An infection can cause profound anemia. Pale gums, pale eyelids.
That Famixus score comes in here.
Exactly, for assessing that anemia. And you see that classic bottle jaw swelling into the jaw from protein loss. Importantly, though, diarrhea is not typical for pure Haemonchus. If you see diarrhea, think other worms are likely involved too.
And it likes warm, humid conditions.
Thrives in them. Short life cycle, maybe 3 weeks. Huge egg output. Major driver of anthelmintic resistance because we target it so much.
Okay, next. Ostratagia, the brown stomach worm. Different mechanism.
Totally different. Ostratagia larva burrows into the lining of the abomasum or C3, damaging the gastric glands.
The acid-producing ones.
Yeah. So the stomach pH goes up, digestion gets impaired, and the animal starts losing protein through the gut wall, a protein-losing gastropathy.
What does that look like?
Clinically, chronic weight loss, poor condition, often diarrhea. In severe cases, the stomach lining gets this thickened, nodular look like Morocco leather, and it's the key player in that fading elk syndrome.
You mentioned something called hypoviosis with ostratagia, like hibernation.
Kind of. It's a crucial feature. The larvae can arrest their development, just hang out dormant in the stomach lining for months, often over winter.
And then?
Then they can all emerge suddenly, synchronously, in late winter or spring. This mass emergence causes severe acute damage, type 2 ostracagiasis. It can hit older animals hard, even if they have some immunity. Very dangerous.
Sneaky. What? Okay. Trichostromalus stomach or intestinal hairworm.
These are smaller worms. They damage the lining of the stomach or small intestine, causing what's called villus atrophy. Basically, they flatten the little projections that absorb nutrients.
So poor absorption.
Exactly. Leads to poor digestion, poor absorption. Classic signs are persistent diarrhea, often dark, sometimes called black scours, and progressive weight loss. Also highly resistant to dewormers.
And Nematardurus thread-necked worm, you said this one's unique.
Very unique life cycle. The infective larva develops inside the eggshell, and these eggs are tough, really resistant.
So they wait.
They need a cold period, like winter. Then a specific temperature rise around 10 degrees C or 50 degrees F-AVT to trigger a mass hatch in the spring.
A coordinated attack.
Pretty much.
Yeah.
It means young animals, lambs, crias, fawns, face this sudden, massive larval challenge all at once. Causes acute, watery diarrhea, severe dehydration, rapid weight loss.
And the tricky part is the damage happens before eggs show up in feces.
Exactly. The larvae migrating into the intestinal wall cause the severe disease. So you can have animals dying before the pre-patent period is over, before they're shedding eggs. A negative fecal test means nothing if the clinical signs fit Nematodaris.
Let's switch to a really different one. Paraliphostrongalus tenuis, the meningeal worm. The neurological scourge, that aberrant host example.
It's devastating. And you have a perfect illustration of the aberrant host problem. Its normal, definitive host is the white-tailed deer. Doesn't cause much harm there.
Where does it live in the deer?
Adult worms are in the meninges, the membranes around the brain and spinal cord. Eggs hatch, larvae pass out in the feces.
Then snails and slugs get involved.
Right. Terrestrial snails and slugs eat the larvae. They're the intermediate host. The larvae develop inside them to the infected stage.
And the problem starts when a llama or moose or elk eats one of those infected snails.
Exactly. Accidentally while grazing. In those aberrant hosts, the larvae get lost. Instead of staying in the meninges, they migrate randomly and destructively through the actual spinal cord and brain tissue.
Causing neurological damage.
Severe neurological damage. The worms don't mature, don't reproduce. It's a dead end for them. But the damage they leave behind is often fatal.
What are the signs in, say, an alpaca?
Signs appear maybe 30 to 60 days after infection. Purely neurological. Progressive. Often asymmetrical, affects one side more than the other. Lameness, weakness, incoordination, stiffness, difficulty getting up, paralysis, head tilt, circling, ultimately death.
And it doesn't take many worms.
Shockingly few.
Yeah.
Studies have shown as few as 5 larvae can cause 100% morbidity and high mortality in llamas. Just 5.
Okay, moving on. Cystodes tapeworms. Some are harmless, some are serious. Let's start with the common intestinal ones. Monietzia.
Yeah, Monietzia expansa. Very common in young ruminants and camelids. They can get huge, meters long. You might see segments like rice grains in the feces, which alarms owners.
But they're not usually harmful.
Generally low pathogenicity. They use tiny mites on pasture as intermediate hosts. Rarely cause clinical signs, despite their size.
But then there are larval tapeworms where the intermediate host gets sick, like Taenia and Echinococcus.
Exactly. The disease happens from the larval cysts in the herbivore.
Like Taenia crabae, moose measles.
Right. The definitive hosts are canids, wolves, coyotes, dogs. They shed eggs. Intermediate hosts like deer, elk, moose ingest the eggs, and small cysts form in their muscles. Looks like measles.
Harmful.
General harmless to the wild host. And perfectly safe for humans to eat the meat once it's cooked. It's more of an aesthetic issue for hunters.
But Echinococcus granulosus, hydatid disease, is a whole different story. Public health implications.
Massive public health importance globally. Again, canids are definitive hosts. Intermediate hosts are ungulates, sheep, Cattle, cervids, camelids, and humans can be accidental intermediate hosts.
What's the difference in the cyst?
Instead of small muscle cysts, Echinococcus forms large, fluid-filled, hydated cysts. Can be orange size or bigger, mostly in the liver and lungs.
And how do humans get it? Not from eating meat.
Critically, no. Humans get infected by accidentally ingesting the microscopic eggs passed in the feces of an infected dog or other canid, contaminated hands, food, water.
And those cysts grow in us.
Slowly, yes. They act like tumors, causing serious problems due to the space they occupy. Prevention is all about breaking that cycle, stopping dogs from eating infected organs, good hygiene.
Okay, next group. Trematodes, the flukes, associated with wet areas.
Definitely. Liver flukes, like Fasciola hepatica and Fasciola magna, have complex life cycles needing specific types of amphibious snails as intermediate hosts. Snails need wet environments.
So Fasciola hepatica, the common liver fluke.
Broad host range. 2 phases. Acute phase. Young flukes migrate through the liver tissue, destroying it. Chronic phase. Adult flukes live in the bile ducts, causing inflammation, scarring, thickening, can block bile flow, cause jaundice, cirrhosis.
Signs are pretty general.
Often nonspecific, yeah. Poor condition, weight loss, maybe anemia. Diagnosis needs fecal sedimentation because the eggs are heavy and don't float well.
And Fasciola magna, the giant deer fluke, another aberrant host situation.
Perfect example again. Natural hosts are deer and elk. The fluke gets walled off in a capsule in their liver, usually causes minimal damage. They coexist.
But in cattle or sheep,
Or camelids.
it's a disaster. No encapsulation happens. The fluke just keeps migrating continuously through the liver, causing massive damage, bleeding, often fatal. And because they can't reach a bile duct properly, they don't shed eggs in these aberrant hosts.
So you can't even diagnose it before death.
Nope. Impossible antemortem diagnosis in those hosts.
Lastly, the protozoa. Microscopic but big impact. Coccidiosis, Eimeria species. Highly host-specific. So deer coccidia don't infect llamas. Llama coccidia don't infect sheep, and so on. Direct life cycle animals swallow oocysts, the eggs, from the environment.
And they damage the intestine.
Massively. They invade and destroy intestinal lining cells, leads to poor absorption, fluid loss, bleeding. Severity depends on how many oocysts are ingested.
Primarily a problem in young animals.
Mostly, yeah. Especially stressed ones, like at weaning, you see diarrhea, often watery or bloody dehydration.
And in camelids, it sounds like Eimeria is a really big deal, especially one type.
It's a major cause of illness and death, yes. There are small coccidia causing diarrhea in young crias, but the really nasty one is Eimeria mycosiniensis, often called EMAC or large coccidia.
What makes it so bad?
2 things mainly. 1, an incredibly long prepatent period, 32 to 43 days. That's the time from infection until oocysts appear in the feces.
Okay.
2, severe, often fatal disease can happen before oocysts are shed, maybe up to 2 weeks before.
So an animal can be dying but have a negative fecal test?
Exactly. Severe weight loss, lethargy, colic, massive protein loss. But no oocysts yet. Diarrhea isn't even a consistent sign. And the oocysts themselves are huge and heavy and need special flotation solutions. Very insidious.
Wow. Okay, and finally, Cryptosporidium parvum. Crypto. Zoonotic.
Very much so. Broad host range. Famous for causing human outbreaks, often linked to contaminated water. Primarily affects very young animals, neonates, 1 to 4 weeks old.
What's the main sign?
Profuse, watery diarrhea scour. Leads to really severe dehydration quickly. Adults can carry it without symptoms, shedding oocysts.
Then it spreads easily.
Highly efficient transmission. The oocysts are immediately infective when passed. They're incredibly tough in the environment and resistant to most common disinfectants. A real challenge in nurseries or calving pens.
All right, we've covered the rogues gallery. Now, diagnosis. How do we actually know what's going on in an animal? What are the clinical signs, subtle or obvious?
Often they're subtle. Gradual weight loss, not thriving, dull coat, maybe just lethargic, off their feed. And remember, subclinical infections, no obvious signs, cause most of the production losses. They're just quietly draining the animal.
But are there specific red flags, things that really point towards parasites?
Definitely. Anemia, pale gums, pale inner eyelids, screams, blood feeders, especially Haemonchus. That's where Famicus scoring is so useful.
Okay.
Subcutaneous edema, that bottle jaw, points to severe protein loss, often from Haemonchus or Ostratagia. Diarrhea suggests gut damage, Trichostrongylus, Nematodyrus, Eimeria, crypto. Fresh blood or mucus might indicate the large intestine is involved.
And in neurological signs?
Absolutely. Any neurological deficit weakness, stumbling, head tilt in an area with white-tailed deer, P. tenuis has to be high on the list immediately.
Any other odd signs?
One unusual one, mainly in camelids, is precocious udder development in young females. It's strongly linked to hyperinfections with a different nematode, Strongyloides papillosus.
Okay, so visual checks help. What about fecal tests? The standard approach, what are the limitations?
Fecal exams are the workhorse, yes. Qualitative flotation is basic screening. Just tells you if eggs are present. But the solution used matters need denser solutions for heavy eggs, like trichuris, EMAC, or fluke eggs. Centrifugation helps sensitivity.
And counting the eggs.
That's quantitative fecal egg count, FEC, usually the McMaster method. Gives you eggs per gram, EPG. Useful for estimating burden and absolutely essential for fecal egg count reduction tests, the FECRT.
That's for checking drug resistance.
Exactly. Treat an animal, check the EPG before and 10-14 days after. If the count hasn't dropped by at least 95%, you've likely got resistance.
Are there other fecal techniques?
Yes. Fecal sedimentation for those really heavy eggs like liver flukes, fasciola that don't float. Behrman technique uses warm water to recover live larvae, like strongyloids or lungworms. Larval culture involves hatching the eggs and identifying the larvae, especially to tell apart those similar trichostrongylus, eggs like Haemachus versus Austrortasia. And emerging tools like PCR can give precise species ID and even detect infections before eggs are shed.
But you mentioned a critical flaw with relying only on fecals.
This is so important. Egg counts don't always correlate well with worm numbers or disease severity. Haemachus lays tons of eggs, others lay very few. And crucially, major damage can be caused by larvae before they mature and lay eggs.
Like with Nematodiris, EMAC.
Exactly, or type 2 Austrortagia, or P. tenuis, causing neurological signs. These animals can be incredibly sick, even dying, with a 0 egg count.
So a negative fecal doesn't rule out parasites if the animal is sick?
Never. Absolutely never rely solely on a fecal in a clinically ill animal. It's just one piece of the puzzle.
So what other pieces do we need? Ancillary diagnostics.
Right. Tools used on the animal or in the lab. We mentioned FAMA-K for anemia assessment on farm. Body condition scoring, BCS, is vital hands-on assessment of fat cover, a key indicator of chronic problems.
Blood work.
Blood analysis gives objective data. CBC for anemia, low PCV or hematocrit, biochemistry for low protein, maybe high eosinophils, a type of white blood cell often up with parasites, or elevated liver enzymes like GGT if liver flukes are damaging bile ducts.
And for neurological cases?
Cerebrospinal fluid, CSF analysis, tapping the spinal fluid. Finding increased eosinophils there is suggestive, though not definitive, of P. tenuis.
And if an animal dies, the gold standard?
Postmortem exam. Necropsy. It's definitive. You can see the worms, count them, see the damage, find migrating larvae, identifies specific lesions like that Morocco leather stomach. Invaluable for understanding a herd problem.
Okay, this brings us squarely to solutions. We know routine deworming led to this resistance crisis. So integrated parasite management, IPM, is the way forward. It's about sustainable management, not eradication.
Exactly. The paradigm is completely shifted. We simply can't keep doing what we were doing.
Remind us quickly how resistance develops.
Simple Darwinian selection. You treat a population of worms. Most die, but a few genetically tolerant ones survive. They reproduce, passing on those resistance genes. Repeat often enough.
And the resistant ones dominate.
Precisely. And certain practices accelerate it. Treating too often. Treating every single animal at once. Underdosing, not giving enough drug. Like a really bad one. Treating animals and immediately moving them to a clean pasture.
Why is that so bad?
Because you're seeding that clean pasture only with the resistant worms that survive the drug. You've selected for resistance and given them a clean slate to multiply. And resistance to all major drug classes is now widespread, including in camelids.
So the heart of IPM is strategic deworming, using this idea of refugia. What exactly is refugia again?
Think of it as the refuge for susceptible parasites. It's the portion of the total parasite population not exposed to the dewormer. So larvae on the pasture, plus, critically, worms inside any animals you don't treat.
Why is that so important?
It's the single most important factor in slowing down resistance. It ensures that any resistant worms surviving treatment are likely to mate with susceptible worms from the refugia. This dilutes the resistance genes, keeps them rare. We want to maximize refugia.
And the main way to do that is targeted selective treatment, TST, treating only some animals.
Exactly. It's the cornerstone. Instead of blanket treating everyone, you only treat the individuals who actually need it, the ones showing clinical signs, or whose production is clearly affected.
Based on that 80-20 rule.
Right. Often, about 20% of the animals carry about 80% of the worms. By targeting that 20%, you help the animals most at risk, but you leave the other 80% untreated, preserving a large in-host refugia of susceptible worms.
How do you pick which ones to treat?
Using objective criteria. FAMICA score, body condition score, obvious signs like bottle jaw or severe diarrhea, poor growth rates. It's data-driven. And studies show TST can cut dewormer use by 80% or more without harming productivity.
Just for context, what are the main drug classes we're talking about?
Broadly, three main anthelmintic classes. Benzimidazoles like fenbendazole, albendazole, the white trenches, nicotinic agonists, levamisole, pyrrandil, the clear drenches, and macrocyclic lactones, ivermectin, moxidectin, plus specific anticoccidial drugs for Eimeria and Crypto.
And for camelids and farm deer, there's this issue of off-label drug use.
Huge issue. Very few drugs are officially licensed for these species, so almost all use is extra label, meaning the vet takes full responsibility for safety and efficacy, often using doses extrapolated from other species.
Which is risky.
It is. Camelids metabolize drugs differently, often needing higher doses than sheep, for example. But underdosing breeds resistance, while higher empirical doses raise safety and withdrawal time concerns. It's a real challenge. And porons are generally out for camelids.
Okay, so smart drug use is key. What about non-chemical approaches, environmental and pasture management?
Hugely powerful tools.
Yeah.
Breaking the life cycle on the pasture. Rotational grazing is fundamental resting pastures long enough, often 3+ months, for larvae to die off. Keeping grass taller, maybe above 3–4 inches, as most larvae are near the soil.
Stocking density.
Lower stocking density means less manure, less contamination per unit area. Mixed or multi-species grading is excellent. Grazing camelids with horses, for example. Horses hoover up camelid larvae, but aren't affected by them. They're biological vacuum cleaners.
Safe pastures.
Using clean pastures, fields tilled, used for hay, or grazed only by unsuitable hosts for the most vulnerable animals, like weaned young stock.
And basic sanitation.
Makes a difference. Elevated cedars stop animals eating off contaminated ground. Cleaning up camelid dung piles regularly. Fencing off chronically wet, boggy areas denies habitat to fluke snails. Clean water sources. It all adds up.
What about focusing on the host animal itself, nutrition and biosecurity?
Good nutrition, especially adequate protein, boosts the animal's own immune system, making them more resilient to infection and disease. And biosecurity is non-negotiable, especially for new animals.
Because they bring in resistant worms.
They're the biggest risk. Strict quarantine protocol. Isolate new arrivals for 3–4 weeks, ideally off pasture, dry lot. Then treat them, often with a combination drench, using multiple drug classes simultaneously to kill worms resistant to any single class.
Then check if it worked.
Absolutely. Do a fecal aid count 10–14 days later to confirm the treatment was effective before letting them join the main herd.
And vector control for things like meningeal worm.
Yeah, strategies to reduce contact with the intermediate hosts. For P. tenuis, that might mean better fencing to keep deer out, clearing brushy areas near pastures to reduce snail habitat, maybe targeted use of melissicides in high-risk spots. For Echinococcus, it's about preventing dogs accessing carcasses or raw organs.
This is all great practical stuff. What about the future? Novel and alternative strategies. Anything exciting on the horizon?
Definitely. There's some really promising research. Bioactive forages containing condensed tannins plants like Cercilia spedeza, bird's foot trefoil, chicory. Grazing these can directly reduce worm burdens and egg output, plus improve nutrition.
Wow, plants that deworm.
Kinda, yeah. And biological control with nematophagous fungi like Duddingtonia flagrans. You feed the spores to the animals, they pass through into the manure.
And attack the larvae there.
Exactly. The fungi germinate and form networks that trap and consume the developing nematode larvae in the dung pat. It stops the next generation before they even get onto the pasture. No chemicals, no resistance issues. Really clever.
That sounds like sci-fi. What about genetic selection? Breeding resistant animals.
Huge potential. Resistance or resilience to parasites is heritable. We can identify animals that naturally handle parasites better, lower egg counts, stay healthier despite infection. Using tools like estimated breeding values, EBVs, allows producers to select for these traits. It's a slow process, but the gains are cumulative and permanent. Some breeds, like St. Croix sheep, are naturally quite resistant already.
So IPM is the plan for farmed animals. But what about managing parasites in wild populations? You can't exactly round up wild elk for TST.
Exactly. It's a totally different context. Not really a veterinary problem, more ecological management and public policy. Direct treatment is usually impossible.
And maybe not even desirable.
Right. Parasites are part of the ecosystem. Wiping them out could have unintended consequences, maybe create naive populations susceptible to future outbreaks. Intervention is usually only considered for major die-offs, population threats, or serious risk to livestock or human health.
So what can be done?
Management tools are ecological. Host population management, like regulated hunting, to keep densities in check. Habitat management prescribed burns might reduce snail habitat for P. tenuis. And critically, preventing introductions, strict rules on moving animals around to stop parasites spreading to new areas.
Which brings us back to that wildlife-livestock interface, that porous boundary.
It's a critical zone for parasite exchange. Wildlife acts as a reservoir for things like P. tenuis or Fasciola magna that spill into livestock. Wild deer can contaminate pastures with Ostratagia.
And livestock can impact wildlife, too.
Oh, yeah. High-density farms can amplify parasite loads, creating hotspots that spill back into wild populations. But the really scary emerging threat is anthelmintic resistance, jumping from livestock into wildlife.
That would be terrible. Untreatable parasites in wild animals.
It could be catastrophic. A permanent loss of control options and a reservoir continually reinfecting farms. It highlights the need for landscape-level thinking, strategic fencing, buffer zones.
And collaboration.
Crucial. Farmers, vets, wildlife managers, public health officials, everyone needs to be talking and working together because their domains are so interconnected.
We've covered a huge amount today. It's crystal clear that just relying on drugs isn't sustainable. Integrated parasite management is the only path forward.
There really is. It's about being smarter. Accurate diagnosis, using drugs strategically, TST, preserving refugia, and layering in all those non-chemical tools. Pasture management, nutrition, biosecurity, genetics, tailored to each specific farm or situation.
And always keeping that One Health perspective in mind.
It underpins everything. The health of that alpaca in the field, the elk on the ranch, the deer in the woods, they're all linked. We need that cross-disciplinary collaboration.
Looking ahead, though, there are reasons for optimism, new tools coming.
Definitely. Research is ongoing. Novel anthelmintics with new modes of action are in development. Vaccines are a major goal. There's promising work against Haemonchus, and some vaccines, like for crypto and cattle, are already becoming available. Genomics is making it faster and easier to identify and breed for parasite resistance. And the potential for biological control with those fungi is really exciting for sustainable pasture decontamination.
So as we finish up, it really makes you think. Understanding these tiny organisms, how they interact with their hosts and environment, it has huge implications for the health of, well, everything up to entire ecosystems.
It's a constant evolutionary dance, this arms race, and knowledge is definitely our best weapon.
Makes you wonder what other surprising connections are out there waiting to be uncovered. Something for all of you to think about.